Hello and welcome to Ignite 2021's On-Demand Industry Panels. My name is Stacy Moore and I'm the Director of Career Services at Delaware Valley University. The panel tonight, focused on human health, is part of the Career Services Office Career Exploration Series. You can actually check out more of our industry panels on the Career Services SharePoint site. We're very excited to have each of our industry panelists with us to share more about their career stories and career paths. Please note that each of our panelists are willing to connect with our students. So if you as a student would like to connect with any of the professionals you hear from tonight, simply email cspd@delval.edu and we'll get you taken care of. So without further ado, I'm going to have our professionals start by introducing themselves with their name, their title, and their organization. So we will start and kick it off with Kristi, and then whoever would like to follow.
Hello, I'm Kristi Moore. I'm a registered dietitian nutritionist, otherwise known as an RDN. I work at Grandview Health, and which is in Sellersville, Pennsylvania.
Go ahead, Barb.
Hi, I'm Barbara Krier. I'm a hospice liaison clinical educator for Compassionate Care Hospice.
And whoever else would like to go, Mel or Brian, whoever would like to go next.
My name is Brian Long. I'm a paramedic by trade for the last 20 years, but currently I'm a chiropractic student out at Northwestern Health Sciences University in Bloomington, Minnesota.
And I'm Melissa Roseman, a physician account executive with Quest Diagnostics.
Thank you. I can tell from all of the titles and organizations, it's going to be a very interesting, informative panel. And to start with that and to just learn about each of you a little more, could you, in the same order is fine, just explain or share how you got started in the career that you're in or working toward now?
Okay, when I went to college, I started out as an elementary education major. I had worked with kids in a lot of different settings throughout junior high and high school, and I thought that I would probably be pretty good at working with kids, so I picked elementary ed for a major. And during my sophomore year of college, we had an opportunity to spend some time in an elementary classroom as one, for some college credit. And I realized that this wasn't something that I probably would want to do like for the next 30 or 40 years. So between my sophomore and junior year, I kind of reevaluated my goals and things I was good at and things that I enjoyed. And also some people had encouraged me as a high school student to go into nutrition, but I was kind of afraid that I wouldn't be able to handle all the science that was involved with that field. But by the time I was almost a junior in college, I felt like at that point, I felt like I could handle that. And if I was really motivated, I could get through all the sciences. And so anyway, I also had a couple of good friends in college that were in that major, which really helped. So, and they said they would definitely help me. So, and I just, I got really motivated, and I loved what I was doing. I loved my classes. And so that's where I ended up as a dietitian, a registered dietitian.
Okay, so I actually became interested in the field of end-of-life care when I did my internship through DelVal. I was a non-traditional student. I graduated in 2014. I did an internship at Neshaminy Manor, which is the local county nursing home. And I also did an internship with a hospice company. But my true passion really was ignited when I was participating in the Semester at Sea program, where we studied through South and Central America, global mental health. And I interviewed someone on board that was having some problems with her transition into a nursing home. And she was this very vibrant human being. And she had kind of been dumped by her family, or they were trying to make choices for her. And she just really wasn't happy. And that really made me interested in the idea around counseling, psychology, and geriatrics, and how they're misdiagnosed with depression, things like that. And as my internships progressed, I became very interested in the field of hospice and having some personal experience with family as well.
Brian, how about you share next how you got started?
Okay, so I've had a very long and windy career, we'll say. I wasn't a great student in high school, so college really wasn't an option right out at the outset. Like Barb, I'm a non-traditional student, class of 2014, but I didn't start college till I was 27. So I went in the Navy. I was on active duty from 2002 to 2006. Or 2008, sorry, where I was a Navy hospital corpsman, so I was basically a medic, combat medic type stuff. But there I worked in primary care. I worked in did a lot of primary care and occupational health type stuff. Then from there I went and became a paramedic, and I was a paramedic for about 5 years. While I was going to DelVal, I worked full-time at night and went to class full-time during the day. It was a pretty rough time, but got through it. And then from there, I transitioned into occupational health full-time, where I worked at the United States Mint down in Philadelphia as a safety and occupational health specialist. And then my most recent job, before I decided to come to chiropractic school, I was the safety and occupational health manager for the VA Medical Center at Coatesville out in Chester County. And then now I'm in chiropractic school. The reason why I decided to come this route was one, personal experience. I've had a lot of issues from the military where, let's just say, medication or surgery wasn't helping, and chiropractic helped me. And I was looking at going to medical school or becoming a physician of some sort. So this is the route I chose. The other reason was the opioid epidemic. As a paramedic, been to one too many overdoses that all had the same story, where they could, they all had some innocuous injury that, their primary care, and not through any fault of their primary care providers, but they were just prescribed an opioid, and next thing you know, they're hooked and doing heroin. So I think being part of the prevention as opposed to being on the other end appealed to me.
Perfect. So I actually have a very interesting path with what I did with DelVal in my career. So I actually was a undergraduate major with zoo science, so somewhat related to what I'm doing currently in my field now, but not on the animal side of business. And I also have a master's in business administration. So I graduated in 2008 and 2010 respectively. And my career began in healthcare sales, actually because of an advisor that I was partnering with at DelVal. She's also a professor, Dr. Robin Shizlaskis, and she actually really saw my passion for pharmaceuticals and biotechnology and research when I had a class that I had taken from her. We partnered with the Biotech Center in Doylestown. And she always tells me I just lit up when I could see the research that was happening at the institution and realized I want to be part of something like that. So she sparked me to pursue the rest of my degree and to taking a look at the industry of pharmaceutical sales. She told me I could sell to an Eskimo, ice to an Eskimo if I really wanted to. So I thought, okay, let's give it a try. Let's see what happens. So I entered pharmaceutical industry in 2012, and I started with a diabetes portfolio at Sanofi, and I worked, my way up. I partnered with specialty pharmacy companies working on biologics. I then ventured into hospital sales, and now seeing the patient and providing the solution at Quest Diagnostics.
Great, thank you all. It's really helpful to hear just the different journeys that we all take, and I appreciate all of the insights of it's not always a straight path, is it? So speaking about your current environment, your current industry, what would you say some of the typical challenges are that you face day to day in your profession? And again, we'll start with Kristi.
So I was thinking about that, and I thought that probably working I spend a lot of time with patients and sometimes their families. And most of the time, the people are very appreciative of what I have to offer as far as education and advice as far as how to improve their nutrition. But occasionally you'll get that patient that has no interest, and they really could. And I just, as a person who knows the importance of nutrition, I kind of want to just like dump all my information on them anyway. And sometimes that doesn't work. So kind of, I think just kind of special, like trying to make what I give the patient fit them and where they are now is definitely challenging. Also, communication can be an issue at a hospital. It's getting better, I believe, but because there's so many electronic ways we can communicate now, but communication between the different staff, between us and the nurses and us and the doctors is always, it's important, but it's always a lot of times very difficult. And of course, prioritizing in the world of COVID when we're super busy, and there's a lot of people we need to see, but there's some that are probably sicker than others that need more of our time. So just kind of starting your day out and prioritizing and figuring out what you're going to do and what's going to make the best use of your time for that day. So those are some of the things that give me challenges on a day-to-day basis.
Okay, so my challenges have to do directly with the idea of end-of-life care and the stigma associated with the word hospice. Hospice is a Medicare benefit. It can be accessed with a terminal diagnosis, and the benefit begins with 6 months of coverage. However, no one really knows when that 6 months is going to be up. So people can graduate off of hospice. They can stay on for a year or more, however long, as long as they continue to qualify under the metrics set out by Medicare. However, families and physicians feel like hospice is giving up. They feel like they failed the family, or the patient feels like they failed their doctor. And very often they go after aggressive treatments that are going to cause more side effects than cure the disease. Families get confused about palliative care and hospice. They're both symptom management. Palliative care is symptom management at any point during the disease process, like if they're receiving chemotherapy or other therapies that need to have their side effect symptoms managed, where with hospice, it is also symptom management, but it's without the component of aggressive treatment. So people get that confused a lot, and they think when they hear the word hospice that it means that they're dying, when in fact, hospice is about supporting and educating the patient and the family, providing them with spiritual support, with social work, with nursing support, and medicine. And it's just such a wonderful support mechanism for anyone going through an end-of-life illness. However, very often the referrals or the doctor will say it's time for hospice, and they continue to perpetuate that end of life where there's only a couple days or a couple weeks left, and the person comes on to hospice and very soon after they pass. Whereas if they made the recommendation earlier in the disease process, then people would start to associate the word hospice with the support that it truly is. So that's my biggest obstacle. And then of course, COVID, barring access into hospitals and physician offices, and really having to adapt some out of the box thinking, and having parking lot meetings and outdoor events and drive-by events. And it's really changed the scenery as far as being able to access the people that you're trying to educate. That's a really big obstacle, but it's fun thinking of creative ways to get to the people that you want to educate.
Okay, well, I'll talk about some of the challenges of being a paramedic, as well as in chiropractic as well. So the biggest challenge EMS faces is resources, public resources. A majority of the EMS systems in this country are not publicly funded. So even in, take Bucks County, where DelVal is for now, there's not a single, or one, Ben Salem, is the only one in the county that is publicly funded. So it's all run off insurance, and which is fine, just like any other healthcare, but they don't get billed directly. Like the ambulance company doesn't receive the payment directly from the insurance company. So they're dependent on that payment going to the patient, and the patient paying the ambulance company, which doesn't happen most of the time. The patient usually ends up keeping the money. And that's just one of the biggest issues is money. It's people aren't going into the profession because it doesn't pay well. Compared to other professions, it's definitely a profession you do out of love, and you love what you do. Where, I think, for similar education, you can go become a nurse and make probably twice the money. So the other, and about chiropractic, I think the biggest issue we face is, as a profession, is most other healthcare professionals don't know what we actually do. So it's tough to refer or receive referrals when especially when you're another MD, or you're referring to a physical therapist, or you're trying to get a referral from them. We've done a terrible job at communicating what we do. Part of that is some bias from the healthcare community at large, but a lot of it is also our own lack of communication.
So the biggest challenge is, especially when it comes to the current environment right now with Quest, is being expected to be working almost around the clock because of our extreme partnership with helping the community with COVID testing. We have been, frontline and center since March of last year. And the patient is, obviously what we are all working together for. So the biggest challenge is, especially in my role, is to understand that, clients might be reaching out to you very early in the morning or very late at night asking for help. And, you're expected to be almost on call to be able to help them. So I think that shows passion, as well as just knowing what the current environment is, just being mindful of that. Competition, even when I was in pharmaceutical sales, there were a lot of other companies that were selling insulin that, had a great product that I had to compete against. So being able to knock on doors and understand why your clients are utilizing a certain product or a certain service, or be that solution. So in my situation, we have a very major competitor in the market that, obviously is what we call a single source lab, where they compete neck and neck with Quest. And we have some other labs, they're what we call boutique labs. They're a little bit smaller, and they can offer offices a little bit of a different perspective. So it's just being able to understand the dynamic and kind of, not being afraid of rejection either, because that could be a future growth opportunity that most don't see. So just having that tenacity and drive to just keep on going, even though there might, the grim of hope is very, very small, you can at least try to be able to win business that way. And then lastly, I think probably, I'd say maybe for all of us, or even others out there, just internal collaboration with, a corporate environment, especially when we're navigating what a new normal might be, or outside or inside of COVID, and holding everybody accountable to the same standard and making sure that we all can drive the same message home is something that I feel like I found within my various careers within healthcare sales. And I probably could say maybe we've all experienced a piece of that somewhere. So those are kind of the barriers that I see.
Thank you so much for sharing that. And I know our panelist, Kristi, needs to head off for another commitment. And so I would love for this to just be the opportunity for you to share both the answer to this question, if you have any final advice for our students. So what we'd love for you to cover before you leave is a brief example of a professional obstacle or a failure you faced and how you overcame it. And then of course, any parting words of advice.
Boy, that's a tough one. I guess it's not really an obstacle, but I really feel like keeping the field of nutrition is changing, has changed a lot over the last 30 years, 20 years since I was since I had become a dietitian. And I feel like it's a challenge to find time to work full time and then keep up with all the continuing ed and all that you have to do to stay abreast of everything that's going on. And so I think one of the nice things is, working with a team of dietitians. How I've overcome that is that the team, our team at Grandview, each of us has a different interest. So we kind of learn a lot about that one particular interest, like say diabetes or nutrition support or whatever it is. And we share that with each other. And there's also in the Academy of Nutrition and Dietetics, which is our main professional affiliate association. They have practice groups. So you can actually belong to, like, say, the sports nutrition practice group, or the weight management practice group, or the healthy aging practice group, or oncology practice group. And you can really focus in on a certain specialty and get to know that specialty really well and do continued education on that particular specialty. So it kind of makes it a little less overwhelming. So I think I joined a couple of practice groups that I was interested in. And so that's really helped to really keep me focused and keep me abreast of everything that's going on. So, and I guess, what was the last question?
Oh, sure. Any advice that you might have for today's students if they were interested in going down this path?
Yeah, I would say, I know that DelVal, I don't think DelVal has a nutrition program. I don't know if they even have any nutrition classes, but I know it's it has a really good science program. I know my husband is a DelVal grad, so he graduated with a biology degree from DelVal. So, but I think anybody that has a science background can easily, maybe even as in the master's program, can get themselves into another school that offers a nutrition program. And in fact, in 2024, I think they're going to require all the RDNs to have a master's degree in order to sit for the exam that they have to take. So it's always possible and I love hearing about people that have changed their career in midlife and, that kind of thing. So anything can happen. Anything's possible if you're really motivated to and interested in nutrition. It's a very interesting field. And I've always gone to work, and I mean, sure, you have bad days, but for the most part, I've always enjoyed and look forward to going to work every day. So thank you for having me on the panel. I really appreciate it.
We really do appreciate it. And we know you have to head off, but I did want to say that the great news is we have incorporated nutrition into our programs at DelVal.
Oh, good.
So,
Oh, good.
yeah. So great advice. And thank you so much. And feel free to pop up at any time, and we'll continue with our next panelist.
All right. Thank you so much.
Thank you.
Bye-bye.
Bye. Now, Barb, you don't have to share the advice piece yet if you want to focus primarily on the obstacle or failure piece.
Okay. I think most of my obstacle is what I mentioned before, just the topic. And I tend to pick difficult topics because before my first career, I spent 20 years in child abuse prevention. And that was a very difficult topic that people really didn't want to talk about. And people often ask me, how did I go from children to gerontology, working with our older citizens? And I said, they're both very vulnerable populations. And I'm also one that wants to go after the difficult task and take on what I think is really important. So just trying to get people to talk about hospice is really difficult. Also, when you're out and people say, what do you do? And I say hospice, then I hear everyone's stories. And there's a lot of wonderful stories of support out there. However, when you're out and about, if you really don't want to go into work mode or into counseling mode, then maybe just say you're in healthcare, which I've learned to do. But I'm also a very great source of support to my friends and family as our parents are aging. And so they see me as an expert in the field. With having my master's in aging services management, I'd like to say that I'm, pretty much of an expert in the field, along with many, many meetings with families. And So that's really the COVID and the topic, the industry getting physicians and families. I mean, I can have a physician identify that someone needs our services. And then if the family, it's really, really difficult to get across the idea of dignity and compassion at the end of life. People just don't think about that. So just getting the message across is my big obstacle.
So I think one of the biggest obstacles for any healthcare provider, whether it be a paramedic or a chiropractor like myself, is keeping on top of the research. So if you're relying on a textbook, that textbook is outdated the day it was published. So I would encourage people to really, there's some aggregators out there that can kind of pull the research together so you don't have to spend all hours looking for it. But that is, I think, one of the biggest things is keeping on top of the current research and making sure you're treating your patients to the current standard of care. Because things change like anything. Some things stay the same, but things change more often than not. It's just really, really difficult because you're working a full-time job and then you're trying to keep on top of that research. Much like our nutrition colleague here, she said that there's specialty groups. There's also specialty groups in both EMS and paramedics or chiropractic, where you want to go in a certain specialty, like there's critical care specialties for paramedics. There's what they call community paramedicine now specialties, which are basically after the people get out of the hospital, they go to people's houses to prevent readmissions. There's also, in the chiropractic world, we have sports, we have orthopedics, we have nutrition, we have chiropractic internists, we have radiology. So if you're really interested in one of those areas, you kind of get with one of those groups and they can kind of help you keep abreast. And as far as being a chiropractor, I think the biggest challenge we face is people think we're just bone crackers and that's all we do, or joint crackers. And where I'm at, we're trained to be primary care physicians. We just don't treat with drugs or surgery. So, I mean, what that means is, I do the same exams, same diagnosis, same everything as our MD-DO counterparts. I just take a different treatment tact when it comes to it. So I think that's one of the biggest obstacles also in our profession as a chiropractor.
I think one of the biggest obstacles in particularly my healthcare career or just journey being in pharmaceuticals and et cetera on that aspect is, just to be transparent with all you guys, is potential instability and layoff conversations. So I'm proud to say this now, but if you probably asked me this a few years ago, I shunned by this, to be honest. Is in the past couple of years, I've been laid off twice, and no fault of my own, I would hope. Company reorganizations do happen quite often within this industry. And to actually share with you a story, today I ran into a rep who's been in the industry for about 35 years. And I haven't seen him in probably about a good 6 to 8 months. And I would see him quite often and, literally catching up in a day. And he's like, did you hear what happened to me? I said, I haven't seen you in a couple of months. What happened? He said, I lost my job, and, top performer doing really, really well. And it's unfortunate. It's not about, you or what's happening. It's just, unfortunately, they might hire some third-party company and look at things and they just number crunch and it just pans out the way that it does. So I always say have a little bit of thick skin, because when you do break into the industry, you'll land on your feet pretty fast. In my couple of layoff times, I landed on my feet, knock on wood, within 2 months. So usually it's just, just getting out there, networking, I think is the most important challenge to that. But again, I think for all of us too, it's, is if you feel passionate about what you do every day, that's just a little struggle you have to deal with, and then figure out like, what's the next step for me moving forward. And if you build connections early on and network with others, you'll be able to land your feet even quicker, because of that. And I think too, with a lot of competition out there, when this in the midst of COVID, you find yourself even more connected to others, because you can't necessarily be right in person. So you find opportunities where they are, and just being open to those opportunities, because now a lot of people are looking for people like me, in the industry that I'm at. And just like all of us here are looking for others just like us. So I feel like if you just stand strong on what you're looking to do and the path moving forward, you'll get there.
Wow, I think that's an excellent place for us to conclude, because not only did we get the answers to your questions, you actually, I don't know if you each realized it, but you provided advice in it. So I do want to give you all, if there is anything that you feel you didn't have a chance to say, please give you a second to share, but no pressure, because what you just all shared was excellent. Go ahead, Barb, sure.
Okay, so in terms of advice, like Melissa and Brian said, find your professional groups and do a lot of networking. People move around in this industry all the time. And also do professional interviews. Go and meet with the person. Use your status as a student to learn about the field that you think you want to enter. Also get an internship. I know it's fun working at the yogurt stand down the shore over summer, but it's really, really important to do internships and develop those professional relationships. And again, I had someone come up to me one time, and I was networking at an event, and I was a master's student at that point, and he said, use your student status to get in and talk to people. They will open up and talk to you about what they do and what they're kind of like what we're doing today. Also do your homework on the company that you think you want to join. There's Glassdoor, there's Yelp. You always want to be really careful, because there's disgruntled employees that might make some negative statements. So you really need to look at it around the board. Glassdoor will tell you some standard salaries that you can expect. And was there something else? I think that was it, but that's my advice. And love what you do.
If I could give one piece of advice to people that are current students, in your classes, do not just learn to pass the test. Learn the material to use it later in life. And if you're looking at going into graduate school or in some sort of healthcare profession, learn biochemistry, take that biochemistry course and learn it. Take the biology course and learn it, not just, and the physiology course and learn it and know it. And just don't do it to pass the test. And not just the biology classes, but your general education classes. You never know when that material can come in handy. You learn something in ethics, or you learn something in philosophy, or you can strike up a conversation. It gives you an in somewhere for, at a company or during an interview. You never know. So just don't take your classes to pass the test. Learn the material.
I think to kind of piggyback on what Brian was saying too, is we have such a beauty with DelVal. It's such a comprehensive university that you necessarily don't need to go to school for what you're ultimately looking to do. I know that sounds very strange and very odd, because when I was a zoo major, all I wanted to do was be a zoo veterinarian. And I started getting hands-on very early on at DelVal. And I realized you don't have to be a vet just to handle animals. Then when I started kind of looking at that career, I realized I can help others, not just in the zoo field, right, but help the public and be part of those solutions out there for patients. So that's what kind of sparked the conversations with me to look into different aspects. But it's exactly what kind of Brian was saying, is take the courses that necessarily might not be aligned exactly with your major, because you may need them if you start to really think about a career advancing in pharmaceutical sales, let's just say, and you're a traditional business major. And a lot of the outlook might be, well, I'm not a science major. How do I enter pharmaceutical sales? But maybe you take a science course or two, and you can feel very comfortable having clinical discussions with others. Or, like me, I didn't really take much business courses, but I decided, coming towards my senior year, to take a couple extra just to feel really well-rounded, knowing I was going to go for a master's in the future of business administration. So it's along the lines of just kind of getting out there and thinking outside of the traditional normal. And then I think we're blessed with people like Stacy and Katie who connect us with others. They have done such a great job of what Ignite is and what it's become. And I truly believe, I wish when I was a student that we had things even like this, whether it be virtual or in person, because I did not know what networking was until I entered the work industry. So I think if you start early on, there are 4 really great, amazing, I spent some time with all of you guys. I feel like there's 4 great, amazing people here that we can connect to just find opportunities to be able to grow together. So you find somebody you connect with, and just have that conversation. Don't be afraid, because you never know where your life can take you from that point moving forward.
That's wonderful advice from each of you. Thank you. And to piggyback off of what Mel said, all of our panelists, as I mentioned at the beginning of our recording, they're all willing to connect with students. So please do take advantage of each of the opportunities that you have here to connect with these really great professionals who are willing to assist you on your journey, and answer any questions you may have about what they've done to get where they are. So a special thank you to each of you. And we really do appreciate it in the Career Services Office. I know students will get a lot out of this. So again, thank you. And students, reach out to us at cspd@delval.edu and we'll get you their contact